What is a stroke? I'm Dr. Judy Gooch. I'm a rehabilitation doctor, and I've worked for many years with people who have had strokes. First of all, strokes are common. They're the 5th leading cause of death in this country and a leading cause of disability. A stroke happens when the blood supply to a part of the brain is cut off. When the blood supply is cut off, then the brain doesn't get enough oxygen. And when cells don't get enough oxygen, they die. So you can get the death of some of your brain cells with a stroke. The 2 main causes of strokes are from a blockage of a blood vessel in the brain or a ruptured blood vessel leading to bleeding in the brain. The blockage of the blood vessel is called an ischemic stroke, and the bleeding in the brain is called a hemorrhagic stroke. Now, strokes are a medical emergency. If you catch a stroke soon enough, there are often things that you can do to help to prevent it from leading to significant disability. So it's important to know the symptoms of having a stroke. Symptoms can include trouble walking, trouble speaking and understanding, paralysis or numbness of the face, arm, or leg. The effects of a stroke on your body depend on what part of the brain is injured. The right brain controls the left side of your body. So if you have a stroke in the right side of your brain, you might have weakness, numbness on the left side of your body. The left brain controls the right side of your body. Also, in most people, it controls speech. So if you have a stroke in the left side of your brain, you might have numbness, weakness on the right side of your body, and you might have difficulty speaking. Here are some of the symptoms that might happen after a stroke. Hemiparesis or weakness on one side of the body. Decreased awareness of one side of the body. Difficulty thinking. Difficulty speaking and understanding language. Decreased vision on one side of the visual field. Difficulty swallowing. Mood changes or depression. After a stroke, you can have recovery of function. In the first few weeks to maybe months after a stroke, the brain may have some healing, and you may get some recovery that way. Over the long run, there are things that you can do to help. The brain has plasticity, or the ability to change and improve by using other parts of the brain to take over parts of the brain that were injured. One of the videos on the Utah Neurorehabilitation YouTube channel is on brain plasticity. So what can you do to help this brain plasticity? Well, you can use rehabilitation techniques. Often, right away after a stroke, people get some inpatient rehabilitation in the hospital. Over the longer run, you might get outpatient therapy, physical therapy, occupational therapy, speech therapy. There are also a number of things that you can do at home to help after a stroke. Again, on the Utah Neurorehabilitation YouTube channel, we have a stroke playlist, and it shows things that you can do to improve after a stroke.